Hi, I'm Dr. Scott Musinski, and I wanted to create this video to help women better understand pelvic organ prolapse. You may have heard the terms cystocele, rectocele, uterine prolapse, dropped bladder, intracele. These are common terms and anatomic changes that can happen to women after childbirth, typically, particularly women who have had multiple children or large children. These may be accompanied by urinary incontinence or leakage of urine with coughing, sneezing, laughing, or bending. This video will animate from a cross-sectional anatomy what particular parts of the anatomy have changed and will help women better understand what we do to fix them in terms of surgical correction or use of a pessary to provide support and relieve their symptoms. So now let's turn to the animated drawing. Okay, this is the diagram. This is the bladder. This is the uterus. This is the rectum. And this is the vagina. So first we're going to look at the animation regarding uterine prolapse. That's when the uterus itself comes out. And as you can see, it pulls the bladder and pulls the rectum with it, but the leading edge of prolapse is the uterus. However, in an anterior prolapse or a cystocele, the bladder is the one that prolapses. The uterus moves somewhat, but it's not the primary driver of prolapse. In a posterior prolapse or rectocele, the rectum itself is what's prolapsing. You can see the uterus moves somewhat, but the bladder remains relatively intact. For vaginal vault prolapse, the uterus has been removed, and so this happens after a hysterectomy where someone will feel a bulge or a nagging sensation. And so this is the peritoneum that contains the intestines, and the peritoneal sac, or the intracele, is what bulges out. It may take the bladder with it. It can take the rectum with it as well. But these are the individual components of pelvic organ prolapse.